So in the last couple of years, there's been a huge increment in the number of cases and penile augmentations using hyaluronic acid. First of all, it's supposed to be a natural component, biocompatible, organic, that's not going to be rejected by your body. But when you use this, obviously, it's a lot different because hyaluronic acid by itself, concentrated hyaluronic acid, is absorbed in a very short span. So we have to use it along with something else, for example, cofactors. So the union makes it more stable and your tissues don't absorb it as fast. Now, this leaves a residue. So in a lot of you guys thinking that you're having a really good length and girth augmentation, which means that this is something that your body's not going to be able to absorb. So this is going to translate into asymmetries, nodules, irregularities, and they might even hinder your sexual intercourse. Now, this is discomfort, total discomfort. So a lot of you guys that do it subsequently, not only once, but 3 or 4 times in the long run, you're actually stacking 10 to 20% of residue that stays behind. And when you look down a couple years later on, it doesn't look natural. It doesn't feel natural. And obviously your sexual partner isn't gonna like it because it doesn't look real. One of the complications with hyaluronic acid, if it is true hyaluronic acid, because it can be binded to some other factors, is that you have a toothpaste effect. Remember that male penis has a flaccid state, has an erectile state. It's like an accordion. And when we put the hyaluronic acid, how do we mold it? How do we tell it to mold itself? Because obviously we're going to stand up, sit down. So it's going to be like a toothpaste tube that we squish and it's going to become deformed. Tell it to you is biodegradable, compatible, organic. It doesn't work. It's not approved for penis worldwide. And this is why Priapus Surgery uses your own tissues, fat transfer with a very nice protocol with a 90 to 100% integration rate is a lot better for growth enhancement. And this is why doing penoplasty, liberating your internal tissues and advancing your shaft, putting a physiological speed bump is going to give you a longer, not only flaccid state, but also impact on your erectile state. I'm a certified penile expert worldwide. I'm also a certified plastic surgeon and creator of Priapus Surgery.